Got a full house looking here. Bob and Jason as chairs. If you want to go ahead and get us started, we can get the meeting going. We're broadcasting live on Facebook, Channel 3, and the City of Manhattan website.
Okay. So, good afternoon. I'm Bob Koppel. I'm one of the task force co-chairs. And Jason's with us, I believe, too, Jason Smith. So I want to thank everybody for joining, and hopefully everybody's had at least a little time this summer to do something a little different, hopefully get outside and get away. We are certainly seeing a resurgence of COVID cases, not only across the country, but certainly here locally. We'll touch on that in just a minute to give you some statistics. But we did want to do some updates today and also kind of catch up on things because it's been 2 months about since we last met. And, I think we've also seen lots of attempts to have some normal, if you will. I don't know if the word normal is the right word anymore. But anyway, get back to some activities that we were not able to enjoy in the summer of 2020. And we also know that we've got coming up the public schools opening, K-State, bringing students back. So we're going to kind of do some check-ins on those education groups. And obviously we want to talk a little bit about vaccinations, the variants specifically around Delta, because that is our biggest variant of interest in our community right now. And we will provide some information from the hospital. I guess we could actually do that. We'll do that in just a minute because we want to have time to do some updates from some people. And we want to start, though, first with Dennis doing a quick roll call for us.
All right. I am sending some information to make sure another member can get in here. But yes, our famous roll call. We had our one in person 2 months ago. Let's go down the list here. We got a good crew on the line. Start with, is Carla Hagemeister with us yet? She may be delayed. Lisa Sisley.
Here.
Alice Nazimi. Oh, there's one more coming in just a second here. Robin Cole. Linda Cook.
Here.
Dennis Butler.
I'm here.
Mike Dodson. Dennis Cook. Gina Scroggs.
Here.
Mickey Dean. Kara Holly.
Hello from Wamego.
Great. Kelly Laub. Cheryl Grice.
Present.
Shiloh Heger.
Here.
Fanny Fang.
Here.
Karen Hibbard.
I'm here.
Lonnie Baker. Commissioner John Ford.
Here.
Commissioner Dee McKee. Julie Gilbert Walter. Kelly Pascal.
I'm here.
Charles Martinez. Stephen Elstrom. Vern Hendricks. Vern's on by phone. We got Ron Fears on here as well. And Christy, I got her on here, and Jason. And I know we have a new guest here from Fort Riley. Kelly, did you want to introduce the Fort Riley guest?
I certainly will. As you can see, we've got Major Evan Purpuris on the line. Then we also have, you'll meet at another time, I'm sure, Lieutenant Colonel Tickner and Major West. As you know, every couple of years, our folks move on to other jobs, and then we have a new team that joins us here. And so you'll see their names and faces in email traffic and on some of these meetings. So we'll be sure to get all their contact info so you can add them onto distro lists as well. Thanks.
That completes the roll call, Bob.
Great. So I want to back up and just give you kind of updates on some statistics. And I think Alice is going to provide some additional information here in a bit from Raleigh County Health Department. But at the hospital, we actually started the day with 9 positive patients, 1 PUI or person under investigation. Of those 9, 5 of them are in the ICU, and as of a couple hours ago, all 5 of them are now on ventilators. And we also have an additional non-COVID patient who's on a ventilator, so we actually have all 6 of our ICU patients on vent. Of interest, we were talking about this a little bit before we went on. Every one of our ICU patients is under the age of 61. So that is not typical, quite honestly, for our ICU or most others. So people on ventilation in their 30s, 40s, 50s, and then the one person who's 61. So things definitely look a little different this time with this wave of COVID patients, specifically hitting pretty hard the unvaccinated. Hospital admissions across the state are increasing pretty sharply. This is something that the Kansas Hospital Association tracks along with KDHE. Last Wednesday, we were averaging 65 new admissions for COVID across the state into our hospitals. As of yesterday, that was 87 a day. So I think it sometimes helps to keep in perspective. So if a COVID patient does not go to the ICU, they're typically with us close to a week. And so we now are taking 500 beds across the hospital beds across the state just to care for our COVID, non-ICU COVID patients. And you layer on the ICU patients on top of that, and that's why we're starting to have lots of problems with placing people. In the last 2 weeks, we have actually moved a patient to Nebraska, and we are now daily receiving requests to take patients from Texas, Missouri, lots of other states. People are just literally calling hospitals everywhere trying to find places, specifically ICU beds for people. So again, we know the mitigation steps. The kind of longer term solution is get people vaccinated. Short term is things like masking, making sure we're doing good hand hygiene, and social distancing. So we really need a combination of both, I think, if we're going to be successful. And this is obviously a concern for the community, concern for those who we are trying to take care of. So I don't know, before we go on to the updates, if anybody has had any other questions about that, if that's helpful. Or Lisa.
Bob, what's happening with staffing at the hospital? How is staffing and retention being affected by this research?
So our industry as a whole is seeing a lot of turnover. People either they're kind of done, and so leaving healthcare in total. A lot of people taking a step back. You hear a lot about traveling staff, whatever. We currently have over 20 traveling staff here in Manhattan alone at our hospital, and it's just that, especially with the severity of patients, the ratio of people that a nurse can take care of just really goes down. Depending on the status, a patient on a ventilator may be 1-to-1, but it's not just the nurse. It takes a respiratory therapist. It's extra pharmacist time. It's case management time. It's extra environmental services. I mean, it takes a village to take care of every patient, and so that is definitely a challenge. We are unable to move patients out of here today, as an example. You cannot transfer a patient anywhere in this part of the state right now. There's just no beds available at any hospital. So that's, again, significant concern, not just here in Manhattan, but quite honestly across our entire state and our neighboring states. Many of you know I worked in Omaha for a number of years before moving to Manhattan, and I was texting with one of my friends from there, and 2 days ago they had 4 COVID patients at his hospital. This morning they had 17. And so that's the kind of things, obviously, that tax the system. And so again, just really encourage people, take the mitigation steps, take steps to protect yourself and be smart. And and this really is an issue of personal responsibility. It is an issue of personal responsibility. There's no question. But we've got to help some folks understand what that responsibility is at times. So we did want to do some updates today since we haven't been together for 2 months. And so I'll just kind of work through our group. And I don't know, Kelly or Major Peppers, if you want to talk kind of about current status at Fort Riley and kind of what's going on. I know there's been conversation about vaccination requirement for military personnel as well. I know that's not done, but if you guys might want to just visit about what's going on at the fort with numbers, et cetera. Did we lose Kelly? Oh, sure. Go ahead, Evan.
Major Pepperis is going to give you an update.
Here you go, Evan.
So, yes. So again, name's Major Evan Paris. I'm from the engagement cell. So here's kind of the full rundown of what's been going on at Fort Riley over the last kind of like year, kind of obviously touching on the high points. So obviously we've been making great progress. following the protocols that the senior commander put in place, continue to offer vaccines and encourage people to get them from our Irwin Army Community Hospital. The teams are also running mobile clinics out at the post exchange. So, every day we're processing more people through the vaccination clinic. As you know, in May, we were able to drop the mask requirements for everyone on post who's been fully vaccinated and start opening up facilities, conducting some of our normal annual events in the fall. However, with the rapid spread of the Delta variant has led to a new surge in cases across the country in Fort Riley, and unfortunately, Fort Riley is not immune to that. So as of July 29th, Major General Sims, following DoD policy, has reinstated mask requirements in all buildings on post. So currently, when there's obviously people in the room, I'm alone right now, normally you're wearing masks within the buildings. Still keeping the facilities open, but are required to wear masks indoors. We hope the surge is a temporary setback in our fight against the virus, and I think the people of Fort Riley and our entire region take the right steps to protect themselves and others. We'll continue to see improvement again. We hope we don't have to reinstate some of the restrictions we had during the worst parts of the pandemic. However, obviously that's not off the table. We hope the following new guidelines, getting more people vaccinated, will stop the rise in cases and allow us to loosen any restrictions in place. But again, this is kind of up to personal responsibility and up to each of us. If you want to know more details about COVID-19 mitigation efforts here on Fort Riley, what's fully open and what has limited services, we have a coronavirus information on our official website. You can go to home.army.mil/Riley, and you'll find a link to the latest coronavirus information on the front page. Major General Sims' most recent letter and general order, which is updated as of July 29th of this year, are posted there along with a list of facilities and any restrictions or limitations. Links to the Kansas Department of Health and Environment and the Center for Disease Control. That's a kind of a quick rundown, depending on questions.
Well, thank you, Major. Welcome to Kansas. Welcome to Fort Riley.
Thank you.
Alice, did you have some updates from Riley County Health Department?
Yes, I do. Sorry about that. Okay, so starting the middle of last week, we began updating our Riley County data regarding COVID on Monday, Wednesday, and Friday. We will still just be sending out that press release on Wednesdays, though, so I know some people got confused when the press release went out yesterday saying that we've had 18 new cases since Monday, but that's kind of what we're doing going forward. That was at the request of the school district and also some other individuals that are in the medical community, just so they can kind of keep a good eye on things. So we are down a little bit in new cases on average, but still close to 100 new cases per week. Our big push continues to get is for people to get vaccinated. So we have clinics on Thursdays at the health department, and then we're also having a variety of clinics throughout the community. We have 2 coming up this weekend. One is at the mall with Manhattan Town Center. Anybody that gets vaccinated gets a $15 gift card to spend at any of the stores at the mall. We're kind of trying to tie this into back to school shopping. And we'll be using the Pfizer vaccine, so anybody 12 and older will be able to get vaccinated at that event. Then on Sunday, we're having an event at the Little Apple Brewing Company, where anybody that gets vaccinated gets a $50 gift card to Labco. And so we're doing that in partnership with the Greater, I'm going to mess it up, so the Greater Manhattan Foundation and Riley County and Labco will be doing that. In regards to masks, we are going along with the recommendation of the CDC, which as long as you're in a high week, and the commission decided to leave it to department heads. To date, the only department head that I know of that has decided to enact that is the health department. So the health department has decided that all of its employees will wear masks. They will also ask clients to wear masks too, though individuals can refuse to wear masks if they come into the health department. Countywide, still seeing a lot of cases of the...
Well, probably with the first football game, the 3 weeks is better. Yeah.
Sooner's better, yeah. Sooner's better. And it's a week's the difference, because then you won't actually have the full impact of the vaccine until 2 weeks after the second shot. So it's really either a 5 or a 6 week process.
Gotcha.
Yeah.
Okay.
If timing's important, I would get the Pfizer and just roll with it and be done.
Thank you, Bob. I'm sorry. I did have one other question for Alice. You said that Labco gift card. What is that?
So it's Little Apple Brewing Company. That's just kind of the abbreviation. So they're
Okay.
hosting the clinic, and then they're
Gotcha.
also giving away the gift cards.
Okay, gotcha. Thank you.
And Kelly can tell you what you should order.
It's a hell of a deal, Kara. Yes, you visit the mask requirement, but for now it's required. We've lifted the social distancing, and we plan to have the in-person classes. It can be a combination of in-person and hybrid classes, but no longer having the 6 feet social distancing. But we're reminding you, you got to have the masks in place, and we're highly encouraging vaccinations and reminding people to wash your hands and keeping hand sanitizers throughout the campus. So those types of materials are easily accessible. We cannot require vaccinations, but they are being highly encouraged and have our own incentives to encourage people to also get the vaccinations. Students coming into the residence halls will be required to show that they, that they've been vaccinated, or they'll have to be tested. If they want to forego the testing, then they have to upload and show their cards that they have been vaccinated. That'll get them out of the testing procedure. So we will then throughout the semester continue testing at Lafayette Health Center for symptomatic or asymptomatic, and kind of continue a regular testing for those that want to volunteer to be tested. And we do have quarantine and isolation space set up in case it's required or needed throughout the semester. And we do, again, we're just really trying to encourage the vaccination and just telling people to be mindful and respectful of everyone's health and safety on campus. So football will continue to start. The first home game will be on September 11th. And again, it's going to be full capacity. And it's an outdoor event, obviously. So that kind of helps from the standpoint of the masking situation. So I think those really, on Lafayette Health Center, will be able to, if somebody needs a vaccination, faculty, staff, or students can get vaccination or testing at our Lafayette Health Center. So that's really the bulk of the update that we have.
Anyone have any questions for Linda? Okay. Ron, do you want to give an update from the city?
Sure. Thank you. So this past Monday, I put in place a requirement for city employees to, whether they're vaccinated or not, to wear a mask if they're in an indoor facility, and also if there's more than one person in a vehicle, they have to be masked. And we've organized it as long as there's high and substantial transmission occurring in the community, along with some other indicators in the community, hospitalizations. One of those, we're also requiring the public who utilizes our city facilities to be masked. So I anticipate that as we get out of the higher substantial transmission, that would be just a highly recommended for the public that's entering, and also would reduce requirements for masking for those who are vaccinated. We also put in place a incentive benefit to be vaccinated at the recommendation of the Biden administration, indicated that we should use our ARPA money for this. And so if an employee shows proof of vaccination, they'll get a $100 stipend. So I think that's the extent of it. I'm not, I don't think there's interest among the city commission as a whole to institute a citywide mask ordinance.
Does anybody have any questions for Ron? Okay. John, anything from Riley County?
Pretty much status quo. I think Alice summed it up pretty well. We are trying to look to get both vaccination and infection rates amongst those staff and employees from in Riley County, and continue to kind of monitor that. I may also second Ron's notion there that there's not really an appetite to do a countywide masking ordinance at this point in time either.
Anything else for John or Alice for that matter, for Riley County? Dennis, did you have Carla's USD 383 update?
So yes, I do. She gave me, from the school district perspective, she gave me a couple things here. Let me pull that up for you. She said she wanted to highlight, I'll pull up here. She wanted to highlight that 383 does start next Wednesday, August 18th, with a half a day, and that the board did meet last night for their special meeting, and they did approve their 383 pandemic response plan with an understanding that it'll be ready to pivot or adjust based upon conditions, local conditions. And they're going to review it no later than September 24th for their protocols with some masking involved. They're going to start the year requiring every one of the buildings to wear a mask at all the 383 schools. That's for students and adults regardless of vaccination status, is what Carla's sharing. And the goal, of course, is to keep the students and staff in the buildings 5 days a week for in-person learning. She said masks will not be required outside at 383 schools. And then as weather permits, they might do some outdoor learning activities so they can keep some things moving outside. Of course, she wanted me to encourage parents to check their school website, Facebook page, and their emails for information about back to school nights and other important information. And as opposed to last year, for those with school-age kids, the students and parents will be able to be in person in the building prior to the first day of classes next Wednesday. She said each school is making arrangements accordingly to their own circumstances. So for parents with school-age children in 383, check your local school information, but they look forward to having parents back in the buildings. And then she said, as always, they're looking for new team members. So if anyone knows someone looking for a job, there's many opportunities to work for the school district on their website. And again, if you need any more information about the mask policy of the board, their website is usd383.org. That's what she had.
Thanks, Dennis. Don't want to put anybody on the spot here, but Gina, anything that you've heard from downtown folks or any updates?
Sure, I can give you a couple of updates. It's good to see all of you. We have a few businesses who have elected to require masks for both their employees and their patrons. And we have a couple of businesses that have elected to require mask wearing of just their employees. So it's been just going with how they feel and what they think their responsibility is. So we're moving along in that direction. We do have a very, very busy outdoor event schedule coming up, really between starting next week with our August 3rd Thursday and running all the way through December, but we're glad that most everything is outside. So it's hopeful that we're going to stay on track and be able to pull all of those things off. Just want to remind everybody that Barry's Drugstore is always offering free vaccinations. So if you're down here in the neighborhood, please feel free to go and get your vaccine. And we also have Riley County has testing locations set up in the mall parking lot every Tuesday and Thursday from 10 a.m. to 4 p.m. And that's mall parking lot just north of Dillard's at Leavenworth, there at 3rd and Leavenworth. So that's really my update for all of you.
Thanks, Gina.
Yeah.
So I don't think Dennis from Aggieville Business Association is on today. Anybody, I guess we'll take opportunities. Anybody else, either from your organization or business group, have anything that we would want to provide some updates to the community on?
This is Vern. I took the first half of this from my car, so when you did roll call, I probably wasn't heard, but some of you may or may not know, but we partnered with the Kansas Leadership Center to create a 6-minute video in English and Spanish, and on the English version, cropped up in very small, little smaller bits, and it's a very simple video that is just for information and hopefully help some people get off the fence and feel comfortable about the vaccination. If anybody wants that, it's just completed. Please let us know and we can shoot it out to you. It went out to the Rotary clubs in the Northeast Kansas area last night, and so it's a partnership between Rotary and the Community Foundation, the Kansas Leadership Center.
You know, kind of promote coming up for our thing on Sunday and kind of continue on?
Yeah, I think so. It's something that we just need to kind of let go viral in any groups or individuals or social media. I did learn something about YouTube out. There is when you, in some places, when it hits YouTube, it has kind of a screenshot that is probably not the most appropriate screenshot there, but there's no way we can handle it on YouTube when it hits there. But we've done some stuff on ours for social media, and it works out better that way. But I'm learning more about social media every day. So,
Vern, could you share that with Dennis and he could pass it on to the group?
Absolutely.
Thank you.
Other updates?
It's me again. So, how is it that we can help come around and rewrite some of this revisionist history is floating around in disinformation and getting people on board? It just is very, I talk to, our guests, whom are wanting to talk about this and getting, kind of our opinion as as restaurant owners, how we're just all kind of confused, and just how people cannot get on board with getting vaccinated and helping to, just be a community member and, doing the right thing. I just am, so many of us are just frustrated and discombobulated, and, we've all had family members, we've all been in this conversation with friends and family for months now. And, now we're seeing, young children, getting this because of, all of not getting vaccinated. I just want to know how, just get this conversation, how we can help to rewrite this revisionist history and disinformation. And if anybody has any good suggestions and thoughts out there, and, what you're seeing and what you're hearing.
Kelly, this is Kara from Wamego. I will say, again, from a personal perspective, my 17, soon to be 18-year-old went for his sports physical yesterday, and he's the type of kid that doesn't want to be told what to do, and he doesn't want the man telling him what to do. And so Doc was talking to him about getting his vaccine. And the one thing that convinced him as an almost 18-year-old was that, and it's a selfish reason, but I don't care if it's a selfish reason. If it makes him get his vaccine, then it pleases me. But his doctor knows how much sports mean to him, and he said to him, Ethan, do you want to miss 2 football games in a row because you had to be quarantined because you weren't vaccinated? And I had never heard it put that way before, because if you're vaccinated, you don't have to be quarantined. It's my understanding. So he's like, oh, gosh, you're right. I don't want to miss 2 football games. I'm a senior. So I guess whatever, if that helps somebody, maybe that helps. I don't know. But that was my experience yesterday.
I appreciate you sharing that personal story with us, Kara. That means a lot. So it helps to give, certainly me, another perspective in a teenager's mind. So thank you.
Mm-hmm. You're welcome.
Kelly, we had our Med Executive Committee meeting this morning and a fairly animated conversation about this very topic. So I'll give you some context. 100% of the physicians on the hospital medical staff here in Manhattan is vaccinated, 100%. So on one hand, some frustration and just don't understand that a patient will take their advice on an injured ankle or some medical condition or pretty much anything else, but won't take their advice when it comes to getting a vaccine. That's a disconnect. One of them said the virus is actually very unpredictable. The vaccine is very predictable. And again, I think that's just, sometimes there's that disconnect, because it's like, what level of risk are you, I guess, comfortable with? We certainly seen the impact of that. I think one of the others, just, I think a little bit of frustration, one of the other physicians shared that, they just think it's interesting that people will take advice. Experience that actually here in Manhattan, but we have at some of our other sites of care within our health system. That is in part what generated the conversation within our organization, lots of other things too. That's led to us having vaccinations required for all staff by November 12th. Because, quite honestly, so I don't even know who's vaccinated and not vaccinated. Unless I happen to be at the vaccine clinic when they were getting their shot, I don't even know that of my own team. I know the percentage we're at, I know the progress we're making, that sort of thing, but I don't actually even know individuals. And our leaders wouldn't know that either. And so it'd be hard to meet that request because we don't even know that, and there's some privacy issues and stuff involved with that. But I think it's a very real question. One of the reasons we're struggling across the country to staff all these beds that we are now needing to staff is that there's a lot of healthcare workers who are
Any
out.
other discussion or comments about that topic? All right, well, we'll move on to the next subject, and it is money. So there's lots of it out there, and trying to figure out where it all is and what it can be used for is becoming quite a challenge. So I know locally, I was just on a call the other day where they were discussing the rescue funds for the state, and after they pay their liability or what they're going to refund their unemployment insurance fund, I think they have nearly 1.1 billion that they are going to be deciding how to spend, and that is primarily dominated by the legislature. And so even though the lieutenant governor is the chairman of the Spark committee this time, the legislature will be making those decisions. I know in talking to Commissioner Ford and Ron Fear and some of the city commissioners, they will be receiving rescue funds over the next 2 years. They have not been given the rules on how they can spend their money either. I don't know, John or Ron, if you all want to comment on that, but there will be some funds coming to local entities over the next 2 years.
Yeah, I'll make a few comments, Jason. With this particular set of funding, I guess deadlines are a lot different than what we kind of endured in the fall. It's far more stretched out. Some of them can go as long as at the end of 2025 and as short as 2023. So both the federal guidelines and probably the guidelines trickling all the way down for all of that is not in kind of a rush or a panic at this point in time, even though each different entities are starting to develop some of those. They kind of did it in reverse. The last time they kind of came out with the guidelines and then the funding and funding formulas. This time they put the funding out with the intent of kind of developing those spending apparatuses and the direction and the guidance in which to do that separately. So, and of course, instead of having 90 days, we have up to almost 4 years. So I think probably, and I think Ron and I think Dennis from the city both have mentioned this, and I think this is good guidance at this point in time, that whatever those final interim rules are and whatever directions both city and county and state funds are able to use for that, we have a legitimate dialogue and conversation along the way so that we know how to spread those out as thoroughly and effectively as possible. It's basically a one-time shot. I don't know of any other time where this particular type of funding has ever come through, and I don't know that there's going to be another opportunity for these type of funds to come through. And the thing that I point out here is that it's not free money. There is a generational standard that's kind of involved in here. Future generations are going to be making up the difference for these funds that we have currently and will be able to spend. So it's very, very important that we do something strategic and long-term with them, whatever it is that we do decide to do and whatever community partners and people we bring on to accomplish that. So we have time, we have needs, all those things I think will be addressed, but it's not going to be a quick and panic type of process. It's going to be a little bit slow and progressive along the way. At least that's everything that I'm seeing. And I do keep up with our national association and those biweekly calls and some of those other calls that come up in between there dealing with these particular rules, and so does staff. So when the time comes, we can, sit down and have an honest discussion about what is going to be the best way to spend these funds. So I'll be glad to answer any other questions.
I would just, the only thing I would add to that would be that, as Commissioner Ford indicated, the timeline here is much broader than we've had in the past for the funds that we're receiving. We have to have them committed by the end of 24, and we don't have to have them spent till actually the end of 26. So, on the other hand, though, that as Jason indicated, there are tons of direct aid from federal agencies and soon-to-be state agencies that will have timelines on it. And some of them, it varies by agency. Some of them are, first come, first served till the money's run out. Some of them have some other deadlines, but they are more short-term. And a lot of it is duplicative of anything that we would do. And so what I've indicated to our commissioners is that under my thoughts is that we should try to help facilitate folks accessing all of these federal agency funds first, and then see if there's any unmet needs locally, or if we're aware of unmet needs. What I've tried to do is steer people towards these different funds, and it seems like every federal agency, and I'm on all their listservs, so I get all the emails, and invariably 3 or 4 or 5 a week come out with a new grant program, and some of them have very short turnarounds, and some of them have longer ones. So it's something that's challenging to stay on top of, but I do think there are lots of opportunities to help pursue fixing areas that we know will be important for us in the future. So thank you.
And I just put up there, this is the Kansas state agencies, the various funds that they get to work with to administer, and you'll see a lot of them are block grants, relief funds, some for private schools. Utility assistance is clearly there, both through the state and through the federal programs. And so, yeah, there's still a significant amount, as Ron was just referencing, that still have to be distributed. This is alone in Kansas. Then you add all the federal departments and what they're able to administer. there's still a lot of money out there that we can take advantage of.
And this is also separate from the 1.6 billion that the state got to spend on anything that's deemed allowable. So yeah, Marissa, you came up. Did you all have any additional information on any of the programs?
So a little bit. With the Shuttered Venue Operators Grant, that actually is going to be getting some more funding. That closes August 20th, I believe. So for any of your live performing operators, anything like that, theater operators, they can apply until August 20th. And then I believe there's going to be supplemental funding opening up after that window closes. And those funds are going to be about half of the amount of the original award amounts. And so with those funds, they haven't released any details yet, but that should be coming down the pike. Something interesting kind of worth noting is, I'm sure you guys have all heard about the infrastructure package that was passed by the Senate. It still hasn't been passed by the House, but that could possibly end any employee retention tax credits 3 months early. So previously, those employee retention tax credits, if any of your businesses are taking advantage of those, were supposed to be all the way through January 1st of 2022, and I believe if the infrastructure package gets passed, that actually ends October 1st as opposed to January 1st. So we're starting to see just some kind of trickle effects through with all of these really robust programs that they're trying to push through. Obviously, they have to get the funds somewhere, so you're going to start seeing things shift around. So we're trying to keep an eye on all of that, but we'll be sure to keep you guys updated. A quick note on Ron's comment. As the regional council, we are working on developing a regional needs assessment system, and pretty much for the purpose that Ron was discussing of there's all of these unfunded needs, all of these projects that we all need to pursue, all of our communities need to pursue, and kind of where do we direct funds for that, or what funds do we pursue for those needs. So we're actually developing a system that any municipality in our region can upload all of their unfunded needs to, and then we can kind of go through and rank and prioritize those and figure out what do we actually need to be funding immediately, what are some projects that if a funding source comes available, we can immediately pull the trigger on, and so forth. So we're not all scrambling last minute, kind of like how we saw with the CARES Fund. Nobody knew how to approach it right away. How can we kind of get ahead of the curve on that? So we are developing a needs assessment system. Christy might have more details on the timeline for that. We did issue our RFP and did get that approved by our board, but that's something that we're hoping can help out all of our communities, kind of help direct what they need to do with funds moving forward, or what they want to do with funds moving forward. But.
So Marissa, also we have been inundated with from our economic development associations and tourism associations on the amount of money that's available through EDA. You all have a unique relationship with EDA. Is there a way that we can work with you all on helping to determine what's eligible and what is and then help with that application, or is that something different?
Yeah, we can definitely chat about that and see what's available. And Christy, I don't know if you're on, if you can speak more to that point specifically. Yeah. But you might have more details on how we can partner better with that. That we do have a pretty unique situation with them, so we can see. So Christy, I'll hand that off to you.
Yeah, sure. Sorry, I'm in my car. It's a school pickup for the first week, so it's getting a little crazy, but not there in Kansas. But yes, we actually hired a grant writer to be able to help with some of those requests that is just kind of on call. So on a case-by-case basis, we could identify if it's something that we have the capacity to handle, but that is what that person is hired for, along with Marissa. So yes, absolutely, we could partner on that. We are trying to track all the different funding sources and waiting, and have been waiting for a lot of those guidelines to come out. I think what's been interesting this last year, a lot of funding sources that individual groups can apply for, that it might be even more efficient if they are applying on their own, as like private business owners or otherwise. But all to say, yes, we are working on developing a needs assessment system so that we can track what those needs are, and then start putting funding strategies to what those needs are. Unfortunately, system may not be available for about a month and a half. But here soon, we would be launching that. So to learn more soon, we'll be showcasing that and can share more information. But happy to talk to you, Jason, for sure.
Awesome. Thanks, Christy.
Yes.
Any questions for regional council, the county, or the city? Dennis also wanted me to highlight the Restaurant Revitalization Fund, which is designed to help restaurants and other food service business keep their doors open. So that's through the SBA. So if you're interested in that, we can help you with that, or just look on the SBA site. And it is a grant, so no repayments required on that. So any other, I know there's so many different agencies that are working this, any other updates or comments or questions regarding available funding for different things? Okay, so I guess we are close to wrapping up. Bob and I decided, based on the numbers that were coming out, that we went back online, which obviously we were disappointed because I think we liked being able to be in person again. But as of right now, our meeting is scheduled for October 14th at 2 p.m. Technically, and I don't know, Dennis, do you want to explain? It says technically it's the scheduled last meeting. Have we set a course on?
We had discussed as a group, that's why we kind of skipped last month, and we're skipping September to go to October, because the conversation was, did we need to meet? So we kind of felt like we were wrapping down some of our work, and so I'll defer to the chairs in the group. But we do have one more meeting identified for 2021, which is October. And then there was some talk before about maybe, do we just want to go kind of ad hoc? If there's a reason to meet in 22, that's fine. We can end the formal task force role and identify we've met the charge at our October meeting, and then just go from there, however the co-chairs and task force members want to go forward.
And I apologize, I missed the last meeting. Do we owe the city commission a report, or are we?
The thought is we'll do some type of document acknowledging just some of our discussions over time, maybe a little bit of the lessons learned, and talk about if there's recommendations about vaccines and the benefit of them. I think we'd have some concurrence from this group, but I would see a limited document to capture all the time that we've been together and the good work that this group has discussed and the different things that have been involved. But I see it more as a lessons learned, kind of about we wouldn't go back to how we talked about earlier on. There's some of that concern about some businesses were open at the very beginning, some weren't. There are just some lessons learned that we've shared and that we've captured about as we go forward with this pandemic still hanging around, how we might best address it in Manhattan.
You know, and I think it's a fair question too, given that the activity over the last few weeks. What do people want to do in September and October? What we're going to meet? What's the agenda? What sorts of things would you want to? That's quite honestly, that's one of the struggles for Dennis and Ron and Jason and I, is trying to kind of craft what the agenda is each time. So if there's thoughts about that, that actually is hugely helpful.
Yeah, this is Robin, and I do have just a comment about that. And that is that I think that a lot of what we've been talking about recently is of interest to the general public. And that in that regard, we're not special. You know, the people sitting in on this call aren't special, because everybody, I think, could benefit from the conversations we're having at this stage in the game. I think that, you know, numbers coming out from Via Christi, from the health department, you know, those are getting media, they're getting press, and so the public is able to stay informed on those kinds of issues. But when it comes to issues related to like business and that kind of thing, and just other opportunities for businesses or not-for-profits or whatever, I'm not sure that the general public has an opportunity to get that information in a consolidated kind of a way. And as I reflect back on, some of the media coverage or just the availability of this meeting to the general public to watch, one of the functions it has served has been to sort of assemble information beyond just the statistics that are being released by the health department and the hospital. So if there's another way in which to convene that kind of public service information, then maybe this group doesn't need to continue to meet. But I do think that it does serve a function for assembling information that then the media picks up on and communicates through various social, print, media venues. So something to think about.
Yep, me again. I also had a question and, kind of an inquiry, maybe more directed towards, Jason and Dennis here and Ron and John. Has there been any thought or conversation about coming up with some kind of a vaccine passport, not unlike what the state of New York has? I know that in our industry, that is a big thing right now, where certain venues and restaurants are requiring, sometime in September, October, that patrons, customers, guests, attendees will need to show proof of vaccine. And so the state of New York has developed an app that you could just download your vaccine, card, and that's your proof of purpose, that you've been vaccinated. And I didn't know if that was something that, maybe some of this funding, that might be out there, might be available for, or just as a conversation, if it would be of any interest. I just see that, if we start having to require or request that, a customer shows us their, vaccine card, that I can see this would be a really fun little black market gag for somebody, to come up with fake IDs. So I'm just wondering if that might be something to, have a conversation about.
Kelly, that's funny that you say that, because just on the Today Show yesterday morning, they said that there were fake vaccine cards. So that's ours. Somebody's already figured that one out.
They've been available since January.
What was that, Bob?
They've been available since January. Because
Oh, the false ones have?
Oh, the CDC printed them on a white cardboard.
That's true. That's true, yeah.
I guess, and I know Carla wasn't here today. I know the school district, at least for USD 383, they're like 5 weeks in. They have another conversation. I know K-State has a kind of a check-in date once we get into September. That's why I guess I'm wondering, do we need to have our call in September? Because by then they will probably have all kind of reached their interim date of changes. Hopefully, I don't know if we'll actually hear more about the funding guidelines or not, Jason. They have not come out quickly. So I don't know if another month we're going to see that or not. I'm guessing probably not.
I actually think, Bob, you probably will
Maybe they
hear
will.
a little bit more. I don't know how much in depth on that will be, but as time goes along here, I think part of this too is that they needed to get their spending protocols and stuff into place before this late summer break that Congress takes. Having all that in place may have them come back for the fall and start kind of refocusing on that, knowing where everything was at there. I think you're actually going to hear a lot more about this stuff over the course of the fall. Now, whether that falls within the scope of that early October, or is it October 14th, correct, or not, I don't know. But I think as time goes along here between now and the end of the year, we're going to be getting some more depth on that. And just to add to Kelly's question, the state has kind of handcuffed all of us public entities in some ways on what we can and can't do from a vaccination standpoint. So I think if passports are going to be anywhere nearly successful or whatnot, it's going to be the private entities at this particular point in time that'll probably have to make that decision. That's been open for them, but if you're state funded or one of the local entities, it's going to be far more difficult from a legal and statutory perspective for us to be able to do that at this point in time. That kind of sums everything up, at least for me at the moment.
Bob,
that was the comment I was going to make to Kelly, is that we have limited ability to be able to do on a broad scale basis to mandate that type of thing. Most of those initiatives have been state mandated programs.
This is Karen. I have if we as a group could kind of come to a consensus to maybe make that a request through the state, if that was something that all of us could kind of agree with, or just kind of try to press forward on. But thank you.
Karen, you'd start to say something?
Yeah, I've really appreciated the conversation. So this is just kind of some of my thoughts in a what if. The conversations that we have had today have been very, very helpful. Has also been very bone chilling. I think we all know that unfortunately, as we've gone through this pandemic, the vaccinations, to be or not to be, have become very politicized. But I'm wondering if we could use our social media PR firm, that we could maybe help tell the story. I appreciated the comment, Bob, that you shared about Pfizer and Moderna and how long it takes for them to be effective. The effectiveness of them, 94.5 and 95% effective. Certainly, as you shared, how full our hospitals are across the state, not just here locally, but across the state, that those are COVID victims. If I have a heart attack today, what are you going to do with me? And so I think that when it begins for the state that we're in right now, with the decisions that people have elected their choice, whether they want to be vaccinated or not, but then the real push that and the burden that it puts on our healthcare system. Take COVID away, if you have a health issue, you might not be able to be taken care of because of the pandemic that is going on. So with all of that being said, how can we then help deliver a message? Is it testimonies that can be given of, when you're vaccinated, this is what happens? And I'm not talking about having actors. I'm talking about truly having testimonies. I had a conversation, I had a conference call this morning with a gentleman in Texas that survived COVID after 5 weeks in the hospital last year. He is very fortunate to be alive. So, not that we're going out and seeking those folks, but I think when you have that kind of near-death experience, you're going to be more, your testimony is going to be more earth-shattering to people. So I guess my question is it our responsibility to once again have an all-out PR campaign that's more testimonially focused? It's, again, early on the question was, who listens to this meeting? Dennis said, well, there are people that listen. So how do we make sure that we're getting our message to the public so that they understand this is urgent? If you were to have a heart attack today, could you be cared for? And I don't mean that to be a scare issue. It's just a reality issue.
Well, I also would say, along with that, Karen, what is the average cost of a COVID, of being a COVID patient. I mean, that's money. That is people's real money, and what is the average cost? I mean, have y'all kind of assessed that at all, Bob, in your industry?
So there's certainly variability. I mean, I was actually talking with a group of folks back in July. I look at free vaccine, an emergency room visit is going to be at least $1,000. Hospital stay, if you don't go to the ICU, most people are going to have $60,000 to $100,000 hospital bill. If you go to the ICU, it easily could be over $250,000. And what's actually scarier is all the folks who are having issues after COVID. That's actually where the bigger expenses are occurring. We've had a number of patients. We will have probably another one here in the next week that's going to go to what's called a long-term acute care hospital, LTAC, and will most likely be there at least 2 months, if not 3 months. If the individual that is successful, they will have some debilitating health issues the rest of their lives. We already know that. So that's where the actual cost is going to be. It's the long-term issues in this. There's definitely short-term. The capitalistic side of this, quite honestly, is free vaccine or you have a lot of expense. And the county's done a great job, I think. I think the county's done a great job of making stuff available to people. And they're trying, I can't remember, John, we were on a different call last week. But they're trying to really meet people where they are, if you will. And it's not just a cliche phrase. They literally are trying to get to people in all kinds of venues all over our county. So I think health department is doing just a fabulous job of trying to do that. It's just getting people interested and engaged.
Can I give you just a quick example on that? As most of you know, I'm employed out at Florence Manufacturing, and actually today we're having a second round of testing to cover the 31 individuals we started with several weeks back, and we're incorporating our second shift into this shift, and so we'll have to have one more. But we're using the mobile unit and the resources that we have on site. We've started to realize that we're not going to get people to come to us. We're going to have to come to them. But if my math is right here, with 22 and 31, that's 53 people. That's about 15 to 20% of our workforce at this point in time, just with these 2 vaccination clinics and then following up with the last one. I don't know how many outside of that, like myself, have been vaccinated outside of those, but there's a good indication that about 50% of our workforce roughly is probably vaccinated at this point in time. So there is a lot of opportunities to probably accomplish that. I would also mention that everything I'm hearing states that here in the next couple of weeks, the FDA will be fully approving one, if not both, of Moderna and the Pfizer vaccine. It's of my thought that will change the dialogue for a handful of people that are sitting on the fence that aren't comfortable with the emergency status on that, want that fully approved. And I think that will, I don't know what the percentage will be specifically, but that'll help move some people off the fence and getting vaccinated as well. And I've also read that here in the last 4 to 6 weeks with the occurrence of the Delta variant, that there's actually a 13 to 15% jump in total vaccinations. So some people are getting the message. I think there's a group of people you're just not going to get to for whatever reason overall, but I still think there's a large portion of people that are sitting on the fence for various reasons, and there's different opportunities and different ways to get to them and get them vaccinated. And as long as that opportunity is there, we're going to keep trying to do that.
Aaron, I was going to follow up on your comment. Besides Mom Marshall is a key viewer in our viewing audience, we do have media members who are also watching, because this is a venue for them to have the public access to this meeting. And so hopefully some of your comments can be picked up through their participation in this meeting as well, to help get some of the content out of what we're talking about this topic.
Good.
So Dennis Marshall and I have been texting back and forth while we were talking here. If we were to meet in September, I guess to me it makes sense to wait until after the school districts had a chance to kind of reassess K-State's had a chance to reassess. Perhaps we've had our first home football game. Those kinds of things. If we were to meet on a Thursday, it'd be like the 16th. So, and again, that would be an extra ask, and we appreciate the fact that everybody's volunteering their time there. Appreciate that very much. But I think maybe to Karen's point about, and some other folks saying this has been the source of information for a lot of people in the community, that to me, which would be, we typically have been meeting on the second Thursday, this would be the third Thursday, but I just think that might be more effective if we're going to do that, to give these groups chances to kind of work through and see what happens. You know, I think everybody needs some time to see what happens.
I actually think, Bob, we should probably just wait until October myself. And I just say that because school district has kind of put the 24th into place. My guess is they're probably going to go, they have a reason for that particular date, are probably going to work through that. I would assume the university probably meets somewhere around that same time to kind of evaluate those protocols. And that first home football game is on the 11th. And as you've mentioned many, many times, there's usually about a 2-week turnaround before we start seeing numbers. So it would actually, all that would actually put us past that particular date. Or maybe it would be better to maybe do that on the 23rd or the 30th, where we have a little bit more time to see how all those things shake out.
I feel like there is, as we mentioned earlier, someone mentioned the unpredictability, and maybe just keep, if we do decide to wait until October, at least keeping September open around that time frame, because in some instances it will have been a month. And you know, if we keep in mind that we may need to come together in September and have a discussion, because I feel like once school starts back, everyone gets back in school, we'll have a good picture of what may be to anticipate. So maybe tentatively look at September as opposed to waiting until mid-October. I think October would probably give us a better picture, personally. You know, we're going to have, I think, 3 K-State home football games. You know, in September, we've got, you know, some other outdoor activities. I would kind of, you know, with, you know, looking at the schools, and I think that would probably, you know, and there's such a big push, you know, for people getting vaccines right now. I mean, there's so many opportunities. I think that we might have, you know, a better, you know, picture of where we're at in October. That would just be my opinion.
Listen, if there was something that was all of a sudden a dramatic change, we could always schedule an emergency meeting if we needed to. So I would be in favor of October, because there is a little lag time in there from everybody coming back, the first football game. That would give us just a little bit of time. But if something happens where all of a sudden things are really spiking, we could always call something sooner if needed.
Right, that was my point.
And I'm probably going to say, you know, there's nothing that I like better than having a meeting canceled. I love it. And so for that reason, I would rather schedule it in September and then get an email or from Dennis saying it's canceled. We don't have anything to report. And then that way, it's all on all of our calendars, and it gets canceled, and we all feel like we've gained 2 hours of our lives.
Let me put an exclamation point behind Robin. I agree.
And I would say a quick note, I know obviously 383 is the major school district in Riley County, but there's a handful of other school districts in the area too. And I think 475 captures like a very southwest corner of Riley County. And I think their plan is getting reevaluated October 8th. So hopefully, even if we do have a September meeting or cancel a September meeting in October, they'll have an assessment too from their system, whatever they had in place, which I think they were going to release yesterday, and I'm not sure if they did or not, but they're reevaluating that October 8th.
Yeah, speaking of, Marissa actually brings up a pretty good point there. 378 and 384, which of the northern Raleigh County school districts are going on mask recommendations and a little bit of social distancing and hygiene at this point in time. So at some point in time, they may have to readdress their scenarios given what may or may not happen too.
I think as another topic that maybe, I know Robin is probably thinking about it some, but with remote learning last year, I know that kids now have more anxiety issues than they have in the past. But if you're trying to get in with a specialist, just speaking from personal experience, it's a 6 month to a year wait. And so now that remote learners are now going back to school, that anxiety is through the roof. And so what is the advice to all the parents that have children that are still not vaccinated, they're scared to go to school, or if they're not scared to go to school, it's just a new environment, they're not used to it anymore. So what's the advice to get them through until they can be seen? And I know that's a tough question, very individualized, but I think that we're going to see more and more kids throughout the community and throughout the region with that same issue. Surely we're not alone.
All right, well, I don't know that we had consensus there, but maybe we'll do a poll, Dennis.
Oh, just schedule a meeting and let's just cancel it.
We can do that.
All right.
Well,
It's easy to do.
and actually, to that point, I need to double check and make sure those dates don't have a conflict at times so we can broadcast with another city commission created board. But yeah, we'll work through some logistics and we'll finalize the co-chairs and be back in touch.
All right. Well, Bob, you want to close us out?
I think we're good. Just encourage everybody, wash your hands, social distance, wear a mask, right? Be safe. I mean, truly, just help people. I do think it's important. We've got to be respectful of where everybody is, and we just have to talk. We have to talk this through. We've got to talk this through. So, and unless there's something else that's come up, Jason, I think we're good to go. Well, thank you all for joining us this afternoon, and we'll for sure see you in October, and if not, potentially we'll see you in September. Okay.
Bye, everyone.
Thank you. Bye.